Good morning, all you hipsters, early risers, and caffeine lovers. Welcome to the trendiest new coffee shop in town, the Café au Lait Cafe. It is delish. At the Café au Lait Cafe, we will learn about 3 disorders: neurofibromatosis type 1, neurofibromatosis type 2, and Legius syndrome. For brevity, we'll refer to neurofibromatosis as NF. Now, before we get started, let's quickly go over how the sketch will be organized. You need to know the most about NF1, so a large portion of the sketch will be dedicated to it, and we'll place the features of NF1 on the left side of the sketch and along the back center. Hooks corresponding to NF2 will be in the back right, and Legius syndrome will be covered in the front right. Now, I don't know about you, but I'm really craving a double shot non-fat caramel macchiato with extra whip on top, so let's get on in there. Neurofibromatosis type 1, also called von Recklinghausen's disease, is caused by an autosomal dominant mutation in neurofibromin, aka NF, as shown by our non-fat raspberry frappuccino sitting at the barista stand. Why raspberry, you ask? Well, it's important to remember that neurofibromin negatively regulates RAS activation, so loss of NF function results in overactivity of the RAS pathway. You might have also noticed that the barista looks a little bit like Miley Cyrus, huh? This is just to help you remember that old dead guy named von Recklinghausen disease. Talk about coming in like a von Recklin ball. I'll be here all night. In addition to crazy frap flavors and pop star doppelgangers, it also has some fun games to pass the time while sipping on a fresh hot cup of joe. The only problem is I can't decide if I want to play dominoes or that super cool swords game. Recall that dominoes are our recurring hook for autosomal dominant, to remind you that NF1 is autosomal dominant, and our recurring number 1 sword is to remind you that we are discussing NF1. Notably, all the disorders in this sketch are autosomal dominant, so we will only show this one box of dominoes. Oh well, doesn't this guy have the perfect day planned? Coffee and then a nice day of golf? Sign me up. That is, until he spilled his Café au Lait on his fancy shirt. This spilled Café au Lait on the golfer's shirt and the 6 golf club that he's holding serve as hooks to remind you that the presence of 6 or more Café au Lait macules is one of the major diagnostic criteria for NF1. While not specifically shown, for clinical practice you do need to know that these lesions have to be greater than or equal to 5 millimeters in size if prior to puberty, and greater than or equal to 15 millimeters in size after puberty. Well, it's too bad that our golfer completely ruined his fancy golf shirt. Man, it was so cool with that crow logo on it. What was really impressive is they even managed to splatter coffee into his armpits. Yikes. This crow's shirt with the axillary coffee splatter is to remind you of Crow's sign, which represents axillary frecklin in NF1, which is often an early sign. However, it's important to realize that any sort of intertriginous frecklin is included in the diagnostic criteria. Now, I don't know about you, but I can't drink coffee without having something to eat, so let's go check out the display cases. First, notice how the food counter is decorated with these classy button decorations that make it look super hipster. Here at Derm Mnemonics, we'll use a button anytime that we want you to think of a neurofibroma, because clinically, these lesions show what's been colloquially termed the buttonhole sign, which is invagination of a lesion when direct pressure is applied, making them seem to buttonhole down into the underlying tissue. Note that the presence of more than 2 dermal neurofibromas and at least 1 plexiform neurofibroma is pathognomonic for NF1, and if making a diagnosis of a plexiform neurofibroma on histology, you should always check for a known diagnosis of NF type 1, because these lesions are almost never seen in any other setting. For plexiform neurofibromas, the buzzwords used to describe the feeling clinically and histologic appearance on low power is a bag of worms. So, we'll use gummy worms like these delicious gummy worms on our snack shelf anytime we want you to think of a plexiform neurofibroma. NF1 patients also often present with a variety of ocular manifestations, including Lisch nodules, glaucoma, and optic gliomas. So, we've placed our recurring ocular sunglasses on our golfer. Furthermore, to specifically remind you of Lisch nodules, we've placed this D-Lisch sign next to our Café au Lait sign. Whoa, look at this plant. That is tripping me out. It is disturbingly curvy and windy. I have no idea where these hipsters find things like these. Anyway, This curved plant is meant to resemble the spine of someone with scoliosis, to remind you that many NF1 patients are prone to developing scoliosis, among other orthopedic findings. Speaking of, pay attention to the stand the plant is on. Can you see how the legs on the stand are kind of bowing and look like shin bones? This oddly bone-looking plant stand with the bowed-out legs is to remind you that NF1 patients also commonly present with tibial dysplasia and congenital tibial pseudoarthroses. Also, since the test writers like to go after findings that you might find on head imaging, you should also know that the sphenoid wing dysplasia is another common skeletal abnormality seen in NF1. To reinforce this, we've placed this super fancy charcuterie board, which kind of resembles a sphenoid bone, on the display counter. Now, what would a hipster coffee shop be without some overpriced salads? Hey, don't worry. Cafe au lait, we're the legit business. So, just check out our Caesar seizure salad over at the counter. This is to remind you that NF1 patients may also have seizures in addition to cognitive impairment. Do you remember this slow, slippery when wet sign from our tuberous sclerosis pool party? This sign is back to remind us that the floor was just cleaned and might be slippery. Oh, and also patients with NF1 may present with developmental delays and learning disabilities as well. Oh, and check this out, another blast from the past. Now, if you watched our Cowden sketch, you may recognize our macrocephaly 10-gallon hat on our golfer. I will say that big hat definitely distracts from the coffee stains, but it will also protect his ears while he golfs. I mean, I don't want him to get a big head or anything, but man, he looks good. Again, this 10-gallon hat is to remind you that NF1 patients may also present with macrocephaly. Before we move on, let's talk about the more serious features that may arise in NF1 patients. I'd like to take a minute to point out that the more severe manifestations and clinical features we need to monitor closely will be here in the display case and one in the parking lot on the left. First, we've placed some crab cupcakes, yeah, pun intended, in the case directly next to the plexiform neurofibroma gummy worms, because it's important to know that patients who experience rapid enlargement or pain of a plexiform neurofibroma may be at risk for developing a malignant peripheral nerve sheath tumor. That's not the only cancer that they're prone to, however. These patients are also at risk for developing chronic myelogenous leukemia, so we've placed a fresh bowl of our lymphoma leukemia limes in the next section. Also, recall that there is triple association between NF1, juvenile chronic myeloid leukemia, and juvenile xanthogranuloma, or JXG for short. So we've thrown in a mango in the last section to remind you of JXG, since they clinically present as yellow-orange dome-shaped papules or plaques, kind of like a mango. Lastly, if you look outside, notice the super hip Fiat parked in the parking lot as shown in our previous Modern Man sketch covering the men's syndromes. This Fiat represents pheochromocytomas, which can be seen in some patients with NF. Oh no, this can't be happening. My drink! It looks like the espresso machine is totally backed up and it's about to burst. Those hoses even look a little aneurysmal, don't they? These aneurysm-looking espresso machine hoses are to remind you that these patients may also be more prone to vascular anomalies, including aneurysms. If you've got the brain power, you can also try to recall that these patients may develop exophthalmos, and we'll add some hip art of a guy who's got big, bulging coffee bean eyes on the back wall as a subtle hook. Now, let's focus our attention on the back right of the sketch where we'll cover the features of neurofibromatosis type 2. Let's remind you of NF2 by placing this picture of a fancy latte. Ooh, boy, talk about some coffee art. Can you see how the foam has been made to look like a two swan? That's to remind you that this is the area designated to NF type 2, and NF type 2 is caused by an autosomal dominant mutation in the SCH gene. SCH is hard to remember, but it encodes the tumor suppressor protein referred to as Merlin, which should be easy to remember if you recall this hipster employee named Merlin. His name tag definitely matches his personality. Just look at those linen hippie clothes, man bun, and holistic amethyst necklace. Clinically, these patients present with neurofibromas, so we'll add some more button decorations to the artwork. However, more commonly, these patients have a subcutaneous lesion with overlying hyperpigmentation and/or hair. To remind you of this, let's make Merlin even more Merlin-esque by giving him a long black beard to remind you of the hyperpigmentation and hypertrichosis associated. Well, I guess you can't technically be a stress-free hippie barista at a high-end coffee shop without some spilled cafe au lait on your clothing. Again, like all disorders in this sketch, the spilled cafe au lait is to remind you that patients with NF2 also present with cafe au lait macules, but usually 2 or fewer. This should be easy to remember since it's NF2. However, the most important feature of NF2 is bilateral vestibular schwannomas, or, for our purposes, swan-omas. I think this will be easy enough to remember given the literal swan, but let's add another swan decoration here next to him to spruce the place up a bit. You should also know that these may also be called acoustic neuromas, and the presence of bilateral acoustic neuromas is diagnostic for NF2. You can also use the fact that there are 2 swans to recall that bilateral acoustic neuromas is diagnostic for NF2. Clinically, patients may present with deafness, tinnitus, ataxia, and headache. To remind you of deafness, we'll give Merlin some recurring over-ear hearing loss headphones, and we'll give him a bell to notify when an order is ready in order to remind you of tinnitus. Lastly, you can use these 2 swans to also remind you that NF2 mutation is on chromosome 22. Now, let's focus our attention on the front right side of the sketch and cover the clinical features of Legius syndrome. We felt it was important to include Legius syndrome in this sketch because these patients also present with cafe au lait macules and other overlapping features with neurofibromatosis. We'll present Legius syndrome with this crazy guy dressed like a Roman legionnaire. Now, I know retro is supposed to be cool and all, but I think it's supposed to be like 20 years ago, not 2000? Anyways, Legius syndrome is an autosomal dominant condition caused by a mutation in the SPRED1 protein, which is responsible for regulating specific cell signaling pathways involved in cell proliferation, differentiation, and apoptosis. To remember SPRED1, just recall how this legionnaire is spreading the topping over toast with his one sword. The SPRED1 protein also interacts with RAS protein for its function, so we've given our legionnaire a delicious raspberry frappuccino. Not all legionnaires can have brawn and brain though, and patients with Legius syndrome are also prone to developmental delay. Hence, why we've placed him sitting next to the slow, slippery when wet sign. Oh no, it looks like this guy also spilled his coffee. Like all the disorders covered in this sketch, cafe au lait macules are a diagnostic feature, and they may also present with intertriginous freckling. So again, we've shown the spilled coffee on his axilla and a crow on his outfit. Alright, let's quickly sum up this sketch. Neurofibromatosis type 1, also called von Recklinghausen's disease, is caused by an autosomal dominant mutation in neurofibromin, aka NF1, as shown by our non-fat raspberry frappuccino sitting at the barista stand. The raspberry frap is to remind you that neurofibromin negatively regulates RAS activation. The autosomal dominant dominoes are to remind you that NF1 is autosomal dominant, and the sword game is to remind you that this area is designated for NF1. The spilled cafe au lait on our golfer's shirt and him carrying his 6 golf club serve as hooks to remind you that you need 6 or more cafe au lait macules to be considered significant as one of the diagnostic criteria for NF1. Our golfer's crow shirt with the axillary coffee splatter is to remind you of Crow's sign, which represents axillary freckling in NF1. The display case with the fancy buttons on it and gummy worms is to remind you of neurofibromas and plexiform neurofibromas. Remember, neurofibromas often present with the buttonhole sign, hence why we're using buttons as our hook for neurofibromas. The bag of gummy worms on the snack shelf is a hook for plexiform neurofibromas, and also to remind you that plexiform neurofibromas often present with a bag of worms feeling clinically and have a bag of worms appearance histologically from low power. NF1 patients also often present with ocular manifestations, including Lish nodules, glaucoma, and optic gliomas, as shown by the recurring ocular sunglasses that our golfer is wearing and the D-Lish sign that is to remind you of Lish nodules. Many NF patients also suffer from scoliosis, as shown by our curvy plant that resembles a scoliotic spine. The oddly bone-looking plant stand with the bowed-out legs is to remind you that NF1 patients also commonly present with tibial dysplasia and congenital tibial pseudoarthroses. Our fancy sphenoid-shaped charcuterie board is a hook to represent that these patients also often have sphenoid wing dysplasia, which can be quite disfiguring. These patients may also have seizures, as shown by our recurring Caesar seizure salad bar, and developmental delays, as shown by our recurring slow, slippery when wet sign. Macrocephaly may also be a clinical manifestation of the disease, as shown by our golfer rocking his 10-gallon hat. Recall that patients who experience rapid enlargement or pain of a plexiform neurofibroma may be at risk for developing a malignant peripheral nerve sheath tumor, as shown by the crab cupcakes by our plexiform neurofibroma gummy worms. The limes are to remind you that these patients are also at risk for developing CML. Our Fiat parked outside should remind you that these patients may develop pheochromocytomas as well. The aneurysm-looking espresso machine hose is to remind you that these NF patients may also be more prone to vascular anomalies, including aneurysms. Lastly, recall that there is triple association between NF1, JXG, and juvenile chronic myeloid leukemia, as shown by the JXG mango. Now, let's quickly hit the high points one last time for NF2 in the back right. Recall the coffee art with the 2-swan foam for NF2, which is caused by an autosomal dominant mutation in the SCH gene. SCH encodes the tumor suppressor protein referred to as Merlin, as shown by our employee named Merlin with his Merlin name tag and a Merlin-esque appearance. NF2 patients present with neurofibromas, often a subcutaneous type with overlying hyperpigmentation and/or hypertrichosis, unlike those of NF1, which tend to be intradermal. So, to remind you of this, we've placed our neurofibroma buttons on the artwork and given Merlin a long black beard to remind you of hyperpigmentation and hypertrichosis associated with these. We added an extra swan decoration to remind you of schwannomas, but the 2 swans serve as a bonus hook to remind you the acoustic neuromas are often bilateral and also to remind you that the NF2 mutation is on chromosome 22. When bilateral, these are diagnostic for NF2 and may cause deafness, tinnitus, unsteadiness, and headache. To remind you of hearing loss, we've placed our recurring hearing loss headphones on Merlin and also placed a bell near them to remind you of tinnitus. Now, let's quickly wrap up and summarize Legius syndrome, which is shown in the front right of the sketch by the guy dressed like a Roman legionnaire. Legius syndrome is an autosomal dominant condition caused by a mutation in the SPRED1 protein, as shown by him spreading the top end using his number 1 sword. Recall that SPRED1 protein interacts with RAS protein for its function, so our legionnaire has a delicious raspberry frappuccino. Also, remember that he's sitting close to our slow, slippery when wet sign for developmental delay. The spilled coffee on his shirt again represents cafe au lait macules, and the coffee splattered to his axilla are to remind you that these patients may also present with intertriginous freckling. And I think that about sums it up. Oh, just in time, my coffee's all done. Hey, can you hold this for me real quick? Just gotta take a picture for the Instagram. All right, I'll see you next time.